the next question, it looks like we got some, how can I reduce my risk of CRS on Columvi?
Yeah, glow fit. So yeah, I mean, unfortunately, a lot of those issues are outside of patient control. I mean, I wish we don't know who's going to really have high risk of CRS. Unfortunately, a lot of the things that we constitute, high disease burden, et cetera, doesn't really probably play such a risk. It's really patient specific. So you really can't really do much to reduce your risk. To the point that you previously, I would say making sure you're aware of the things to look out for. And if you happen to go into an emergency room, especially when it's not affiliated with your hospital, make sure that they are aware that you have received the bispecific antibody and that they don't just work you up for infection. Because unfortunately, cancer patients' fever is a knee-jerk reaction for ER doctors to think infection, and they ignore anything else. So unfortunately, patients need to be advocates for themselves and say, hey, I'm on a different type of treatment. They've said that fever can be a side effect. This is a drug I'm taking. Maybe you want to look into it or call who I'm treating, because again, it's not just infection that you need to be worried about.
Yeah. And Columvi, which is glofitamab, right? That's glofitamab.
That's glofit. Yeah, that's glofitamab.
Yeah. There is, they didn't randomize this, but in the initial study, the phase 2, they changed, some patients were mandated dexamethasone versus a steroid. So dexamethasone is a steroid, and there's all sorts of other steroids you could use. And in the study, they said, use some steroid, whatever you want, but then they changed it where they told the doctors to give dexamethasone. And there appeared to be, now this wasn't randomized or controlled, there appeared to be less serious cytokine release syndrome with the mandation of dexamethasone. So our practice at UCSD is we've built in dexamethasone into the treatment plan. Yeah.
So that's in the label now. So the label.
Oh, it's in the label now. Okay. So
the label for Epcor and Glofit mandates steroids on the day of infusion for Glofit and for the first 4 days for Epco. So if they're treating per label, they will get steroids.